40 million people a day are asking ChatGPT for medical advice, and Mount Sinai just ran the first independent safety evaluation of this thing. Published in Nature Medicine last month, 960 patient interactions, 21 specialties, 3 independent physicians grading every answer. The headline finding: ChatGPT gets the diagnosis right, then tells you to do the wrong thing about it. Which, if you think about it, is worse than getting it wrong entirely because you read the explanation, it sounds smart, and you trust the recommendation. Except the recommendation might kill you. Here's what I mean. In an asthma scenario, ChatGPT identified elevated CO2 levels, an early sign of respiratory failure, wrote it right there in the explanation, then recommended the patient wait and observe. The correct answer was the ER immediately. How about diabetic ketoacidosis? They flagged the elevated blood sugar in the ketones. They recommended home observation. The correct answer again was, well, the ER. In over half of true emergencies, 51.6%, ChatGPT told patients to wait 24 to 48 hours. Not because it missed the signs. It described the signs correctly. It just couldn't connect the knowledge to the action, which is a bit like a smoke detector that correctly identifies the fire and then suggests you make tea. But here's the finding that should genuinely concern you. ChatGPT has built-in suicide crisis alerts. These are prompts that are supposed to direct at-risk users to the 988 lifeline. The researchers found that these alerts fired more reliably when someone expressed general sadness than when someone described a specific plan to hurt themselves. The safety system was inverted relative to the clinical risk. The 988 alert triggered in only 4 of the 14 relevant scenarios. Mount Sinai's chief AI officer said it plainly. When someone describes exactly how they would hurt themselves, that is a sign of more danger, not less. And the system got that backwards. Now, the common reaction here is, well, ban it, shut it down, AI can't do health. But the data is really more interesting than that. Semi-urgent cases, guess what? 93% accuracy. Textbook emergencies like stroke and anaphylaxis, they were nearly perfect. It fails in the gray zone, the ambiguous cases where clinical judgment matters most. And when patients downplayed their own symptoms, ChatGPT was 12 times more likely to agree with them. That's sycophancy. It's architecturally embedded in how these models are trained. The problem isn't that AI can't help with health, it's that the failure mode is invisible. The explanation reads like it came from a physician. The action plan reads like it came from a chatbot, trying not to upset you. The question isn't whether AI should be used in healthcare. That ship has sailed. 40 million people a day have already decided. The question is whether anyone's going to test these systems independently before the next 40 million sign up. I put together a full research brief on this study, every data point, every source, the complete methodology breakdown. You'll find it linked in the article below, and if you're listening to the podcast version of this, the same link is in the show notes. If this is the kind of analysis you find useful, subscribe so you don't miss the next one. And until next time, I'll see you then.